what is your reading of the racial impact, the racial distribution of this virus so far?
Well, Lawrence, it doesn't come as a surprise that this is happening because we had data from China that indicated that individuals with underlying conditions, heart disease, hypertension, diabetes, asthma, they're going to be more prone to severe disease and death. And it's been true in the United States for a long time that minority communities have a heavier burden of all of those things. So it's really not a surprise that minority communities are being disproportionately affected by it. And the other thing, as was mentioned by the young physician you just had on, minority communities are not able to social distance and do some other things that are required to keep the virus out of those communities. So there's a double impact that they have, or a double thing having them in terms of being able to social distance and keeping the virus out of those communities. On top of that, having the underlying conditions that make them more prone to severe disease. So I think that's what's accounting for what we're seeing right now.
And on the social distancing challenge, I mean, we certainly see that in New York City, where everyone has more of a challenge social distancing in New York City. But the lower you go on the economic ladder in New York City, the more crowded the housing is, the more crowded everything is about life, including subway travel and all of that. And so there seems to be an economic component that's interacting with this.
I think that reflects, again, the fact that these individuals are not able to work from home as others are. They have to be on the job, on the factory floor, or serving others in various capacities. So again, the economic challenge is the fact that these individuals have to go to work. They have no choice but to go to work. And some of those working conditions are not conducive to social distancing and protecting oneself against the virus. So minority communities have a lot of things working against them, and that's just another thing added to the challenges they have to face to be protected from the virus.